Hi, my name's Amalia Vasquez. Today we're going to do an NG tube insertion. To start out with my supplies, I have my NG tube, I have an emesis basin for the patient, I have a syringe to suction, I have some tape, I have my gloves, I have some lubricating jelly, a cloth to put over the patient's chest. I also have a cup of water for the patient. I have warm water to stick the NG tube in, and those are the supplies that I have gathered for today. So I'm going to enter the patient's room. Hi, my name's Amalia. I'm going to be your nurse today. I'm going to perform hand hygiene and don clean gloves. I'm going to get 2 forms of verification from the patient. Hi, Mrs. Smith. Am I able to get your name and date of birth? Perfect. Thank you. And am I able to check your wristband? Awesome. That looks great. So today we're going to do an NG tube placement. It looks like you have some fluid in your stomach. So with the NG tube, it's going to be placed in your nose and it's going to go all the way down through your throat, which may be a little uncomfortable when it's passing through, but I will advise you on some ways to work through that. And then it's going to be hooked up to a suction machine to get all those secretions out. Does that sound okay? Perfect. Do you have any questions? All right, thank you, Mrs. Smith. We're gonna go ahead and get started. So I'm gonna raise the bed to a comfortable position for me and the patient. I'm gonna place the patient in high Fowler's. I'm going to take the suction machine out. So first, Mrs. Smith, we are going to measure the tubing. I'm gonna start at the tip of the nose and to the top of the ear, and then measure down to the xiphoid process. Perfect. While we do this next step, I'm going to soak this in warm water. Okay. Mrs. Smith, I would like to figure out which nostril would be better to place the tube in. So can I have you hold one side of your nose and take a deep breath? Perfect. And I'm going to do the same on the other side. All right. It looks like the left side is the side that is more open and sounds good. So we're going to be placing the NG tube through the left side of your nostril. Like I said earlier, it is going to be a little uncomfortable when you get to your throat. So with that, I'm going to have you lean forward and take a big sip of water. And as you're taking a sip of water, I'm going to insert the NG tube a little further. If you need me to stop and to take a breather, you can raise your hand. If I meet resistance, I am going to have to pull the NG tube out and start over. I'm also going to check the bridge of your nose to see if there's any deviation. Everything is in place in its midline. So let's get started. So I'm going to place this on your chest. One other thing that I want to check is I'm going to take my pen light and inspect the nares of your nose just to ensure that they are good. Inspect this side. Perfect. We are going to stick with the left side. Everything looks great. Here is your cup of water, and I will assist you on when you can use the water. All right, I'm going to take my lubricating jelly. If I can get it open. Perfect. And I'm going to take the tip of the tubing. Alrighty, that should be good. Okay, you have your cup of water, Mrs. Smith. So when I reach the back of your throat, or you feel like you have to cough, you can take a big sip of water. And as you do so, I will insert the tube in as far as 2 to 4 inches. Okay, we're gonna get ahead and get started. You want to make sure you insert the tube in the curve that it's going. You're doing great, Mrs. Smith. Perfect. Let's go a little bit more. All right, it looks like you have to cough. We'll take a breath. Go ahead and lean forward. And when you're ready to take a sip of water, I'm going to advance the tube. Okay. Perfect, Mrs. Smith. You're doing great. Lean forward. You're doing great. Oh, good job, Mrs. Smith. Just a little bit more. Almost there. Okay, one more. Perfect, Mrs. Smith. All right, now that I have the tube in place, I'm going to lightly tape it to the nose. Once we get the NG tube verified in the stomach, I will fix the dressing. Just want to keep it there for a little time. Now I'm going to suction out some secretions just to ensure. Checking the pH. Perfect. Then I have my pH test strip. I'm going to put the secretions on the test strip. The pH reading should read between 1 and 4. Some hospitals may be 1 and 5. The test strip is reading between 1 and 4. We're doing great. Now I'm going to take 10 ml of air, and I'm going to listen with my stethoscope. I'm going to place it on your stomach, and I'm going to push air into the stomach, or into the tube, and I'm going to listen in the stomach. And I heard the whooshing sound, so it sounds like the NG tube is placed in the right spot, but we will verify with the doctor's orders to ensure that they have an order for an x-ray on where the placement is. I didn't mention it in the beginning, but doctor's orders are always required when it comes to inserting anything inside the patient, and the NG tube was ordered due to the secretions in the lungs, or in the stomach, I'm sorry, to the secretions in the stomach, and this is for the patient. It looks like the tube is going to be attached to the suction machine. It will be intermittently suctioning, or it'll be continuously suctioning at a low rate, slow rate, so that you are tolerating it well. So now that it is all placed, I can tape it to the bridge of your nose. Perfect. Okay, so there's that. So now that the procedure has been done, I'm going to take off my gloves, dispose of it in the right trash, perform hand hygiene. I'm going to leave Mrs. Smith in a safe and comfortable position. Do you have any questions, Mrs. Smith, before I leave? No? Perfect. So the suction machine is on, and it's going to take some of the secretions, put it in a canister that's on the wall. All right. And I'm going to leave Mrs. Smith with her call light in a safe position and the bed lowered. Thank you.